In this question, you have to identify the lung conditions in asthma and emphysema respectively. Option A, inflammation of bronchioles, decreased respiratory surface. Now in asthma, there is inflammation of the bronchioles and constriction of airways, making it difficult to breathe. And in emphysema, the alveolar walls are damaged, leading to the decrease in the respiratory surface for gas exchange. So, this option correctly describes the conditions in asthma and emphysema. Hence, it is the correct option. Option B, increased number of bronchioles, increased respiratory surface. Now, in asthma, there is no increase in the number of bronchioles, rather, the bronchioles become inflamed and constricted. And in emphysema, the respiratory surface actually decreases due to the destruction of the alveolar walls and not an increase in the surface area. Hence, it is incorrect. Option C, decreased respiratory surface, inflammation of the bronchioles. It is incorrect because the option reverses the condition, because asthma involves inflammation of bronchioles while emphysema results in decreased respiratory surface. Option D, increased respiratory surface, inflammation of bronchioles. This is also incorrect because in emphysema there is decrease in respiratory surface due to alveolar damage, and in asthma there is inflammation of the bronchioles, which is correct for asthma but incorrect for emphysema in this option.